Hello, this is an informational video for patients and caregivers to assist with at-home self-staple removal. Before we start the staple removal process, it's important to wash your hands with clean soap and water. Prior to removing the staples, we'll want you to inspect the incision to make sure it's safe to remove the staples at home. During the inspection process, you'll want to look to see if there's redness, if there's concern for purulent drainage or discharge, or if there's any concern or signs for wound separation. If you see any of these findings, then we want you to stop and call the clinic before proceeding. For the staple removal process, all you'll really need is the staple removal device itself. Sometimes it's good to have some gauze nearby in case there's a little bit of bleeding that occurs with the staple removal process. This is our staple removal device. There's multiple different types of staple removers, but they all function the same way. There's this bottom aspect of it here that goes underneath the staple, and then the top ledge that'll go above the staple. So what you'll do is you'll take the bottom edge of the staple removal and put that underneath the center of the first staple, and then you'll squeeze the handle. This will cause the arms of the staple to deploy, and then you just pull straight up out of the skin. So I'll show you that technique one more time. You're gonna take the bottom of the staple remover and put it underneath the staple. You're gonna squeeze down on the handle. That'll cause the arms to deploy. You'll pull straight up and the staple comes out easily. You're gonna repeat these steps until the staples are all removed from the skin. Following the staple removal process, it's important to inspect the incision again to make sure there are no concerning findings, including redness, abnormal drainage, or wound separation. If you see any of these findings, you should reach out to your clinic. One of our nursing team members will reach out to you later today after your staple removal to ensure that there is no complications with the process. You can expect a phone call from one of our team members 3 to 5 days after your self-staple removal to discuss our post-removal survey. Thank you so much for watching, and please feel free to reach out to our clinic with any concerns or questions.